Good afternoon, friends. I am Dr. Muthukumar. I am a consultant pediatrician and a diabetologist, and I'm also a consultant medical affairs for a Singapore-based multinational company. Today, I'm going to discuss a couple of topics. Before going into this, I would like to thank Ash for giving me this opportunity to share my thoughts and views on a few medical topics. Actually, I would rather say it's a common topics for people who are undergoing this crisis and who, once we come out of this, how our life is going to change. So I'm going to discuss a couple of topics. And at this juncture, I am also thankful to hundreds and thousands of my fellow medical fraternity and doctors, physicians, surgeons, nurses, paramedical staff, who are the current frontline soldiers risking their lives to treat hundreds and thousands of people. As of now, due to this pandemic, about 5 million people, more than 5 million people have been infected across the globe, and a lot of morbidity and mortality is happening. At the same time, as I said, these frontline soldiers, our healthcare professionals, are doing a tremendous job. So the first topic I'm going to discuss is what are the major changes which is going to happen in medical facilities post COVID-19. Just now we listened to a wonderful talk on stress by Dr. Akanksha. It was an amazing talk. You did a good job, Dr. Akanksha. Coming to the major changes, the first and foremost change which is going to happen, or which as a medical doctor we are going to face, is post-traumatic stress disorder. It is called as PTSD. So a lot of healthcare professionals are undergoing immense stress. In fact, recently, maybe a couple of months before, we'd have heard a news, one healthcare professional, sorry, I forgot her name, a valiant nurse, she ended her life. So this post-traumatic stress disorder will be there for a while. After this COVID crisis, this COVID pandemic will be there for a while. Every one of us are hoping that this crisis will end by sometime in December or maybe in the first quarter of 2021. But the good news is the strains, what in India we are facing is muted strains. Though there are multiple mutant strains, it is muted, and our immunity, we call it as inherent immunity, or innate, the inborn immunity is much better than most of the Western population. That's why comparatively, though we have crossed 1.5 lakh of population, our immunity is quite good, and our morbidity and mortality rate is high. So this coming back to the post-traumatic stress disorder is going to be a major factor for all these healthcare workers. So the government and the community health settings has to do something about that. So as doctors, though I'm not seeing any patients as of now, but most of my peer group and my friends are seeing a lot of patients, and I'm in talks with them, so I understand the amount of stress they are undergoing, the amount of the pressure, and amidst the scarce resources, human resources, and PPE and stuff like that. So this one of the major changes which is going to happen post-COVID crisis is in medical facilities is this post-traumatic stress disorder affecting the healthcare workers. And after this crisis, the way the patients are being examined by the doctors and the medical staff itself is going to change. So as of now, most of the patients prefer being seen by the doctor in person in their outpatient clinics or in hospitals, but that the whole thing is going to change. The perception of the patients and as well as the doctors is going to change a lot, and the time spent interacting physically, the physical handling of the patients will definitely come down. And needless to say, the social distancing is going to be a norm. So we have never heard of this terminology. 6 months before, if somebody has asked me what is social distancing, I would not have had an answer. But now social distancing is going to be a norm, and post-COVID crisis, this is going to be a routine practice, and personal sanitization is going to be practiced day in and out by all these healthcare workers, professionals, and as well as the patients. So this personal sanitization using hand sanitizers or cleaning, washing our hands with soap, that is going to stay. So we are getting used to those sort of good habits, and wearing masks as well. So we'll be avoiding all those gatherings without any personal protection. And coming back to the medical equipments, I'm not aware how many of you are, I'm not sure how many of you are aware of the digital stethoscope, digital ECG, or digital echoes, like which is remotely which can be operated. So there's a lot of technology is happening, and these are going to be a norm. Digital stethoscopes and digital ECGs, where patients themselves with limited assistance, they can help themselves, so that the results are interpreted by the physicians and doctors. And the third thing what I'm observing is many of the countries during this crisis or post-COVID crisis, they are planning to come out with passport. We call it as immunity passport. So what is the immunity passport? Immunity passport is something which objectively will tell the medical staff about that particular, for example, your immunity. For example, if somebody is infected with COVID-19 virus, their body will start producing antibodies. So after 2 or 3 weeks, when the body is tested for these antibodies, they'll have, we call it as immunoglobulin G, IgG antibodies will be present. Like that, the immune susceptibility of these patients will be used in the form of an we can call it as an immunity passport or immunity ID. So that is going to become mandatory for all the patients who are planning to visit the hospitals or clinics. And as of now, in epidemiology, we call it as surveillance, health surveillance. So health surveillance is going to be new norm for most of us in community. So we say prevention is better than cure. So this health surveillance will be an indicator for health status of most of the people. And a couple of more advancements what I see, and the medical fraternity and the healthcare is going to witness is, one is artificial intelligence. Artificial intelligence will play a major role in healthcare, especially every one of you is aware of the fact that each government, each country is working very hard to come out with vaccines. Like a couple of countries, the US, like UK, then Australia, Israel, all these countries, even India. There's a lot of research going on in coming out with vaccines for this virus, COVID-19. So this artificial intelligence will play a major role in helping the researchers in coming out with these vaccines. And this artificial intelligence will also help us in preparing ourselves to face future further any pandemic crisis. So that is one thing. And it can also act as a tool for the healthcare providers and healthcare workers to to treat the patients or to be at their best in their practice. Then one another technology which is going to come into play this post-COVID crisis, which is going to change in this medical field, is robotics. Based, we call it as robotic assistance, or this robotic technology is going to play a major role, especially in assisting doctors and during the rounds, and this we call it as this robotic machines, robots. Robots will assist the doctors, and the robots will be used for even disinfecting the hospitals, which is a hazardous act using the ultraviolet radiation. And these robots will be used in removing the biomedical hazard waste. So these are the major changes I do see in medical specialties post-COVID crisis. The second topic which I'm going to discuss is digital upgradation. People who are living in India are aware of an app, a massively promoted app by our Honorable PM Narendra Modi. It's called Arogya Setu. The Arogya Setu app is used for contact tracing of the COVID-19 patients. So even my smartphone, I have uploaded this Arogya Setu app. So whether we like it or not, it's high time we have to embrace this technology. This, if anybody, any citizen of India has not uploaded this app, if he or she wants to travel from one place to another or from one state to another, they will not be allowed. So digital upgradation in the form of apps like this is going to become a norm. And one major change I am seeing in this digital upgradation is the way patients are being treated, the telemedicine. Until 6 months before the telemedicine, there are a lot of startups in this telemedicine platform, like Portia, like Healthify Me, Practo, Liberate, and so many online platforms are there. Following this COVID crisis, this telemedicine portal is going to become very popular, and patients with mild symptoms, they would prefer be seen by doctors through this telemedicine consultation, and the prescriptions will be received in the smartphone and will be uploaded for buying medicine through online pharmacies. And there's one another thing, digital upgradation, which I'm looking at as the vital signs monitoring. See, any patient, when he or she visits a physician or a consultant, the basic things are measured, like heart rate, respiratory rate, saturation, blood pressure, temperature. So now a lot of applications are coming into the market. So artificial intelligence based vital signs monitoring using a smartphone camera or a video is going to come. And we are very much aware of this wearable tech, like Apple Watch, like that, Fitbit, and so many companies are there. So wearable technology through which the assessment of a patient, a probable patient, the vital signs, whether the patient is fit enough to be treated as a patient through a telemedicine portal, or the patient has to come and see the doctor in the hospital. So this wearable technology, through all these wearable equipments, I see a lot of people are going to embrace that. So these are the things I wanted to discuss. And one thing I want to tell all of you friends, we should be extremely grateful to God Almighty and nature for keeping us alive during this crisis. I strongly believe in this. All shall pass through this world, but only once. If we are doing any good things or show any kindness to others, let's do it now, for we shall not pass through this again. I know we are in it's a the life has become standstill for most of us, and millions of jobs have been lost, and lots of companies have been shut down. But change is the only thing which doesn't change. So we are poised for a significant change. Let's hope this 2021 will bring us prosperity, happiness, and health for all of us. Our future action or will depend upon, or our future life, our future for the next generation, everything is going to depend upon what we are going to do right now. So be safe, please practice social distancing, take care of your health, proper hygiene, personal sanitization is very important. So when you're traveling, please use mask. So thank you very much, friends, and thank you, Ash, for this opportunity. May God bless us all. Thank you.